Welcome, dear listeners, to another episode of the Gotham Acupuncture Podcast. I'm your host, Joshua Garcia, and today we've got something truly special in store for you. We're delving deep into the world of Gotham Acupuncture with none other than Dr. Peter Caron. So, if you haven't had the pleasure of meeting Dr. Peter yet, allow me to introduce you to this extraordinary acupuncture practitioner. With over 20,000 patients under his care, Dr. Caron is not just a healer but also an educator and a passionate advocate for the community. Despite his hectic schedule, we're thrilled to have him on our weekly podcast. So, thank you for your time, Dr. Karen.
Well, thank you, Josh.
So, to start our discussion, with over 20,000 patients treated, could you share a memorable success story that stands out in your mind?
Oh, we've had a couple of them recently. I have a patient right now who had amenorrhea. Wasn't getting her period for almost 5 years, and it took us about 3 months to get her period to come back. I had a patient about 3 months ago who came in with frozen shoulder, who was expecting to need surgery, and we were able to restore full range of motion and functionality in about 4 weeks. There's been a lot. I've got a patient who has agoraphobia. From the time of the pandemic, we were able to get them comfortably going outside, and they've now gone to Singapore and Japan in the past
Wow.
month. Yeah, we see a wide variety of things. I'm always happy when a patient is able to not get surgery or is able to improve the quality of their life. Sometimes that just means they can walk more. Sometimes it means they sleep better. So there's both big and small victories, and they happen all the time.
Wow, that really sounds awesome, Dr. Karen. You're a miracle worker, especially
Thanks, Josh.
amenorrhea, 5 years, having no period, and you fix it within 3 months. 3 months is a small window of time if we're talking about 5 years, right?
I'm
So,
pretty happy
wow,
with it. And they
exactly.
are too.
Yeah, that was really shocking revelation that this can be treated with acupuncture. So, thank you for sharing. But let's move on to the free clinic in Harlem. What inspired you
Sure.
to establish a free clinic in Harlem, Dr. Karen?
Oh, that's a good question. Well, the way acupuncture is practiced in the United States, it's very often a medicine that's reserved for people who have a lot of money, for people who are very comfortable financially. And the roots of acupuncture don't mean that that's how it has to be. Acupuncture is a medicine that costs very little for us to do. The needles are inexpensive. It takes a lot of time to get educated. It takes time to get good at this. But once you are, you can see quite a few people quite quickly for very little money. And so when I graduated acupuncture school, I went to Guatemala and spent 2 years doing service work there. I got to gain a lot of experience, and I got to give back to people who needed that. And in coming back to New York, I wanted to create an opportunity for students to do the same thing. So I connected with my community here. I tried to find what areas had need so that we could set something up. And On Point in Harlem is a harm reduction facility. They treat addicts, they treat people who are homeless, they treat the community. Anyone who's willing to walk through those doors gets free services. So it seemed like a perfect place to partner with. So now we're able to take students up there, and the students are able to get school credit for seeing a population that we normally don't access. And I think the students gain a lot from this, in part because they're able to see the results that can occur when people don't have much medical support. Very often, the issues that this community has, say physical issues like pain, are relatively easy for us to treat. But that doesn't mean that they would think to come to us or could normally afford our services. So I see it as a way of kind of a win-win-win. I get to do something that feeds my spirit. I get to create a space where students can get a lot of experience and see a different way of treating. And we get to provide services to people who otherwise have very limited options.
Wow, that sounds great. Thank you for sharing that, Dr. Karen. I didn't knew that that was the reason why you established a free clinic in Harlem, and I agree that it's a win-win-win situation, especially to those people who are really in need in Harlem.
We have quite a few regulars, and we've seen well over 1,000 patients there in the past few years. I'm pretty
Wow.
happy about that.
Awesome. And since we're already talking about Harlem, so running a free clinic in Harlem is very commendable. But can you tell us about the challenges and rewards of providing acupuncture services for free in a community?
Sure. I mean, the rewards are pretty easy. We get to see people surprised at the results that they get, which is always a lot of fun. Very often, the patients that we get are people who've already been to quite a few different medical practitioners before they end up with us. They've gotten their MRIs, they've tried different drugs, muscle relaxants, whatever. And they end up with us often because they're running out of options.
Mhm.
These patients up in Harlem often haven't tried anything because they don't have options available to them. And so when we can improve their range of motion or get them a reduction in pain within minutes, they're often really surprised. And I think that's kind of fun for everybody. The students get to see that as well. The primary challenge is that in Chinese medicine, we think of this idea of root and branch causes of disease. So the root might be a person got influenza, and the branch might be that they have a cough. So they may come into us complaining of a cough, but what we see is a bacterial infection or a viral infection. The problem in Harlem is that a lot of the patients, their root cause is poverty, mental health issues, or addiction, all of which are very much outside the scope of our practice. There's not much I can do for those things. However, the way we see it is that if we can remove pain and anxiety and help people to sleep well, help them to digest well, then they're going to have less of a need for drugs, less of a need for coping mechanisms, and whatever the best road for them to take is, it'll be easier for them to take that. So on the one hand,
Yes.
it's frustrating because there's only so much we can do. On the other hand, that's kind of the nature of all medical practice. There's only so much we can do. So it's kind of like all the other things, just more so.
Got it. Thank you for answering that question, Dr. Karen. And I'm also curious. Can you share a bit about your journey from being a student of acupuncture to now educating the next generation of practitioners?
Oh, sure. Things have changed a lot in the time that I've been in this field. I started in Chinese massage school 18 years ago. So I've been in this profession quite a long time. I graduated from acupuncture school about 8 years ago now, 9 years ago. And even over that course of time, I've watched a number of products that we get from China degrade in quality or change in quality. At the same time, I've watched access to higher quality herbs become available here in the US. On the one hand, some of the quality of teaching has gone down. We had a lot of people who were first and second generation here from China who had learned things before the Cultural Revolution, and they were able to share those things in classes. And now that's less of a frequent experience. We have better textbooks, but we also have sometimes less experience among the practitioners. So, kind of like everything, it's in a lot of flux and in a lot of change. I think it's important to have many different types of teachers within the field. And so I'm pleased to be able to fill the role of primarily a clinician. I don't translate. I'm less of an academic. My primary focus is treating lots of patients with both acupuncture and herbs. And so it's a good time for me to be where I am in the profession, and hopefully the students are getting something out of that.
We knew that you are wearing multiple hats, managing a private practice or clinic, being a professor, and running a free clinic. How do you find balance and prevent burnout?
That's a question I may have to get back to you on. Well, that's a half a joke. I find I'm quite active during the week. I spend a lot of hours a week working. And so I try to balance that out with relatively quiet weekends. My wife also has a very demanding job, so she works long hours. So during the week, we eat dinner together and kind of wind down together. But outside of that, we both work most of the time. And then on the weekends, we're able to get out of town a little, rest a little bit more care. But honestly, balance is something I think we all work to find. And it's a moving
Exactly.
target. What's right in the summer and what's right in the winter here in New York are very different. So it's a work in progress, I think. And sometimes I'm good at it, and sometimes less so.
Sometimes not. Yeah,
Sometimes not.
totally agree with you on that, Dr. Karen. But can you share any personal strategies for maintaining well being while actively engaging in various roles within the field of acupuncture?
Well, I find hiring an assistant from Athena to be very helpful. Thank you very much,
Oh,
Josh.
thank you.
Um, in terms of like personal health and energy management, I think one of the most important things is to know what your body looks like when things start to go wrong and catching things early. So I often refer to this with patients as, if you know you're getting sick, it's better to take a day off and be able to somewhat enjoy the day and rest than to wait until you're really sick and have to take 3 days off and not enjoy it. So there's signs for me that, oop, I've pushed things a little too far. I need to rest a little more, and that often means just blocking off a few hours and sleeping in one of the days that week. So I think it can be very easy for us to push ourselves too hard and then end up owing a large debt of energy. And as long as you keep those amounts, we can push ourselves a little extra, but the bill
Mhm.
for that comes due. And you've got to be able to plan for that intelligently, or else you end up needing my services.
Yeah, exactly. And this is really insightful conversation, Dr. Karen. As always, thank you for sharing your experience and wisdom with us today. But before we wrap up, do you have any final thoughts or advice for me and to our listeners?
Well, anything for you? I've been very happy with how you're doing, and it's been wonderful having you as an assistant. And I'm really grateful for these conversations we have together. It's a lot of fun. I would say the same rules apply to you as to me here. Make sure that you're not burning out, make sure you're managing your energy well. You know, these sorts of projects are a marathon, not a sprint. And what matters is that we continue to work well and effectively for the next 6 months to 3 years, not accomplishing any tasks in one week. We live in a culture, especially here in New York, that's very focused on the next few days of intense work or the next week. And I think taking a longer perspective and thinking about the next year can really help to manage things. Yeah, I think that's the main thing. For our listeners, for any of you who are in New York, I will just mention that make sure that you're managing the humidity in your apartment well. This time of year, we see a lot of people coming in with dryness conditions from the radiators. This causes all sorts of little micro tears in the skin of the throat, the lungs, and the sinuses, and that makes opportunistic infections much easier to get. So if you're finding yourself having some sinus congestion, finding yourself having a little bit of a sore throat regularly this time of year, make sure that you're not getting dried out at night.
Wow. Thank you, Dr. Karen. And there you have it, folks. Another episode of Gotham Acupuncture Podcast in the books. Again, as always, a big thank you, Dr. Peter. So if you've enjoyed this episode, don't forget to subscribe, leave a review, and share it with your friends. Until next time, stay balanced and be well. Goodbye.
Thanks, Josh. Bye,
Thank
everyone.
you.